In Good Shape, your health magazine on DW, featuring an interview with a different expert every week.
And I'm with Dr. Smolka. He's the head of the psychotherapy and psychosomatic medicine department of the Wiegmann Klinik at the Red Cross clinics here in Berlin. Thanks for inviting me into your clinic.
My pleasure.
We're talking about burnout. So the first question is burnout a fashion disease? I think everybody has it.
Burnout is a fashion disease, sort of. The past centuries, there has been always a change in technologies, and therefore there was always problems of exhaustion. So this is not the new part of it. The new part is that in our society now, which is defined by globalization and new technologies, for example, social media, smartphones, personal computers, there is a change and acceleration.
When I had a busy day, I feel tired in the evening. So, but this is not burnout, is it?
Yeah. Well, this is supposed to be working overload. This is quite normal for most of the employees. But if you have a burnout, the severity is much more a problem for the individual.
So is it like a depression?
Mm-hmm. There is a huge overlap of symptoms, for example, depressive disorders, anxiety, or post-traumatic stress disorders. But burnout is not a disease or a disorder, it's a risk factor. And so it is a syndrome with a huge overlap to all these mental disorders.
But as a doctor, you try to treat the precursing disease, the burnout. Mm-hmm. You don't wait for the depression to develop.
Well, it depends. In Germany, for example, burnout is not a diagnosis which is treatable in a hospital. You can go to your doctor and stay there for treatment. But if you go into the hospital, therefore, the secondary disease is depression or anxiety.
And what does the doctor do? Is there any specific test to diagnose a burnout symptom?
Well, you have to watch very carefully because burnout could be caused by somatic disorders as well. Diseases, for example, kidney failure, systematic inflammation, or other diseases. But if it's a mental disorder, then you should go to a psychiatrist or a psychotherapist, and your general practitioner might be able to suggest this.
Dr. Smolka, do you use meditation techniques in the therapy of burnout?
Of course, because meditation is a very good technique to reduce the stress level. There are Asian techniques or more Western techniques, but overall it's a very good therapy method to do so.
And is it difficult to explain this to your patients? I mean, we're here in Western Europe. Meditation is not the main thing our patients do.
Yeah, well, it's such a lifestyle method. Everybody knows about it, so you don't have to have problems to explain it.
And does it depend on the age of the patient? The older the patient is, the more difficult it is to get them into meditation?
Could be sometimes. Sometimes older patients do have some startup problems, but then if they try, they are very likely to do so.
But this is easily to be seen. This is not a meditation room. This is more like an art studio, or whatever you might call this. So this is painting therapy? Or
yeah, it's called art therapy, exactly. Right. I could explain if you would like to. If you are a burnout patient, you would draw in the beginning like this, because you have a loss of empathy to your own emotions, and therefore in the middle of the therapy you will gain access to the nucleus of your emotions and the positive emotions. And then, for example, using mindfulness techniques like dripping, you could show your body in very slow and very mindfulness way.
But how does it actually work? So you sit together with your patients here in this room and you say, please draw a painting and think about burnout while doing this?
Yeah, well, in the beginning it might be quite hard to do so. So you have an explanation, or you have a style which would you suggest as a therapist, and later on in the therapy you might be doing this by so-called freestyle rather than one point.
But how does it actually work in the brain, for instance?
The art therapy is occupational therapy, which allows the patient to find their inner emotions, and therefore they are able to express it. And in the end of the group therapy, for example, the patients talk about it, they get explanation, they do explanations, and therefore this interaction helps them to gain access to their, for example, emotions.
There are different kinds of therapies, next to art therapy, next to meditation. What kind of therapies do you use as well?
Yeah. In the clinic, we would have a multimodal approach for the secondary disorders, for example, depressive disorders, and therefore psychotherapy as form in individual and group therapy would be the first choice. And second choice, there will be, for example, sport therapy or fitness or art therapy or other additional therapies.
And what do patients have to expect? For how long do they need to go into therapy?
It depends a little bit on the severity of the illness. For example, you have shorter courses like 4 weeks. If you have a very severe secondary disorder, then you might be 6 to 8 weeks treatment to gain then your health back.
And after that, they go back into their families, back to the workplace, and they're all healed?
Well, healed is in psychotherapeutic terms not the word we would like to use. We would say they are able to reintegrate in the family, on the working place, and it needs more time sometimes as an outpatient therapy to gain full recovery.
And does it often happen that patients fall back into burnout after years, for instance?
Well, it depends on the circumstances at work, for example. As burnout as a work-related problem, if you can't change anything at your workspace, then you are more likely to relapse, and that might be a problem, of course.
Yeah, so it's a really hard piece of work you have to go through if you suffer from burnout therapy.
That's right.
Yeah. Thanks, Dr. Smolka, for inviting me today
You're
into
very
your
welcome.
clinic. Thank you.